Hello and welcome. This is our Talk to Addis program. I am your host, Abdullah Brahani. Today, I just have brought you an honorable guest to our program. Our guest is Dr. Abubakar Campo, UNICEF representative to Ethiopia. He is by profession a medical surgeon. Do stay with us. Welcome, Doctor, to our program.
Thank you very much. My pleasure being here.
So, like I just have been introducing to you, I will give you another chance. Just, it's good to listen from the horse mouth. So, would you tell us who Dr. Abubakar Campo is to our audience?
Thank you for having me, first of all, on this program. So I'm Dr. Abubakar Campo. I'm a citizen from Mali. I'm the current country representative for UNICEF here in Ethiopia. I have been working with UNICEF for close to 18 years now, on different continents, in different countries. This is my 7th posting with UNICEF. I am quite honored to be here in Ethiopia, which is for an African citizens like I am, a great honor for me being here. I have been mainly working in complex emergency countries, countries which were in war, post-war, or affected by natural disasters. So I do have quite a rich experience, but I also do have experience from headquarter level as well. As I mentioned, I'm a medical doctor with a surgical background. I also have a master's degree in public health. And being from the continent, having traveled to most of the African countries, I really do enjoy the learning of new cultures and mingling with from people from other continents as well, because that's where I feel that traveling is the best education which you can get, and it makes you a better person in the long term. So, in a nutshell, this is me. I'm married and have two lovely children, which unfortunately not always staying with me, because I'm always sometimes in countries which are not necessarily suitable for family life. But this is who Abubakar Campo is.
So I see that you have got, very rich experience and CV, and it's a good opportunity for us to have such kind of person. So to dive into my question, the first one is, would you give us the overview of UNICEF activities in Ethiopia?
As you know, UNICEF is the United Nations Agencies for Children, who is responsible to really ensure that all countries are upholding the rights of children. And we are legislated, and we are emanated from the United Nations Human Rights Charter, which stipulates, a number of rights, like the rights to have shelter, the rights for health, the rights for education, the rights for having a decent job, the rights to the right nutrition. All these kind of different human rights, UNICEF wants to make sure that they start from the beginning and not just when a person gets into adulthood. And in this sense, UNICEF is really trying to ensure that every child, wherever they are, from whatever socioeconomic status they are from, that at least the basic social services, the rights for protection, for example, against any kind of form of violence, the rights for good nutrition so that they can grow that they can grow normally and as well have use their full potential, in terms of other activities like educations and work in adulthood life. The rights the rights for health, so that they basically get protected and survive in the early stages. So all these different rights are regarded from a UNICEF perspective as fundamentals, and this is what basically shape the programs that you have. And this is why the core programs within UNICEF are, first of all, health, the rights for the child to survive from when it's born, or even from the from the first terms of conceptions all the way to at least 5 years. Then after 5 years, so that we can make sure that these children are also thriving, not just surviving, that they get decent education, so that they can grow into responsible citizens to contribute to the society. So the core fundamental programs for UNICEF have always been health, nutrition, because they are fundamental, and water and sanitation, because water and sanitation also lead to health issues. Water is fundamental for life as well, so we're combining those ones as well. The right for protections against violence, really making sure whether it is household violence, whether it's sexual gender-based violence, whether it's any kind of form of violence, all children need to be protected because they are not necessarily able, to speak for themselves. So UNICEF should be standing up for them. The rights to education. Without any education, you will never grow into to a self-reliant and responsible citizens. So education is extremely important. And we're emphasizing here in particular educations of girls because we also know that there are differences within societies there as well. So all children should be having a right for decent education so that they can grow responsibly, into at least giving them the opportunity, the chance of that, we know it's sometimes difficult, but, this is something that we have to do as well. And then for young people, how we include young people, within the society. After education, what comes? Can we create employments for them? Can we give them more opportunities to thrive within the society as well? So these are the different, core values that you have. Now, this cannot be done with some of the cost-secting activities, like, for example, social policy. How countries do have policies in place to really ensure that all these different rights which I have mentioned are basically fulfilled. It also includes behavior change. How do we change our behavior to basically reach those aspirations which we have? I think if people are not seeking help early, then it means they will only come with complicated situations. If parents are not sending their children to school for whatever reasons, then it means that children will be lacking the opportunities of probably a better future in a certain way. So behavior change also contributes to a large extent. And I can tell you also from experience, the better the behavior, the cheaper our program, and the better the outcome, in terms of fulfilling the rights of children as well. So these are the core programs. Everything, UNICEF is involved in everything which will improve the living conditions of children, not just for surviving, but also making sure that we give them opportunities to get the best out of them and be a productive citizens in the future for their societies.
I see that you are doing, multiple programs. There are so much. And my question is, I think they are supposed to be cascaded into different years and months as well. So would you tell us the prior goals that UNICEF has aimed to achieve as of the current year, the year we are on, so far what you have done?
In the European countries, for sure. I think we as UNICEF, we are actually involved in all these different sectors. Ethiopia, I think at least if you're taking our current country program, which is a 5-year program usually, so it's coming to an end this year, next year in July. So in this particular, when this country program was developed, it was 5 years ago. At that time, COVID was not of actuality. The conflict in the north, which was a difficult period for Ethiopia, was also not on the horizon. And at that time as well, Ethiopia enjoyed a very strong economic growth in the double digit, and the vision was much more progressive. Unfortunately, this current conflict was plagued by those crises which I've just mentioned. So it has shifted completely from the development phase to a much more humanitarian phase. So a lot of changes in this vision. So in that sense, UNICEF priorities had become to really mitigate the negative effects from the conflict, from the drought, from the pandemic, which the world has suffered. So we shifted from a very progressive mode to a more mitigation, humanitarian stabilization mode within UNICEF as the entire society in itself. What has been our achievements? I think we have been contributing to the efforts of the government to reduce as much as possible the mortalities during the COVID-19 pandemic. So stabilizing the countries, supporting the government in making sure that vaccination against COVID-19 is basically available, that the health services are not completely stopped because of lockdowns in different areas here as well. In terms of water and sanitation, we know that waterborne disease are still one of the major causes of deaths for children under 5, but also in terms of morbidity of the causes for consultations with the facilities. Even during those difficult times, we have been continuing, providing, drilling boreholes, providing water to communities here and there. During the conflict, it's the same. We have been continuing providing emergency services for displaced populations. We are providing water, education, safe place for children to keep playing and keep staying children. Reducing the suffering and consequences of those different crises as well. We have been looking in terms of protecting children. As we know that in every single crisis, whether it's man-made or whether it's natural disaster, women and children are the most affected one. So how can we bring relief to those communities there as well? And we're doing this not just within UNICEF, but we're also working with other UN agencies who are also providing relief. So there are certain who do food distributions because UNICEF does not do food distribution. In terms of nutrition, we look and see children who are malnourished. We classify them and then provide basically assistance, therapeutic feedings to those ones, but also looking into communities how they can prevent moderate malnutrition so that they do not slide into in severe malnutrition as well. So there are quite significant achievements done in this respect. All programs which UNICEF does are contributing to bring in stability and relief. Unfortunately, because of the multiple crises which we had over these years, as I mentioned, the conflict, the pandemic, and drought, because we have been having successive drought, has not been able us to move as much as faster forward in terms of development, but at least it has helped of reducing the number of people who are suffering, of alleviating some of their suffering. And this cannot be done just by UNICEF. This is just in a support to the efforts of the government, because the government has been taking the leads in those different aspects. And I can give you a little bit later a little bit of more concrete examples which we do, what we're doing in water and sanitation, what we're doing in health, what we're doing in nutrition. But as a nutshell, we could have done more with the support of donors. We should not be forgetting them, because we enjoy quite a large numbers of support from donors to basically achieve those results. So it's not just an achievement from UNICEF alone. There are quite a number of stakeholders who are making it possible that UNICEF can achieve some of these results within the field. But since we are multi-sectorial, and since we also have foot on the ground, because this is a very important notion as well. As UNICEF, we do have 12 field offices. We are not just an agency who operates from Addis Ababa, So in every single region has their own offices. We are quite mobile. We work with communities so that we can address their issues with them and not necessarily for them.
So you were mentioning, while you were mentioning, I just see some challenges. That was my question actually. You might have touched it, but if there are some challenges that families and children in Ethiopia are facing right now, in which, in your case, like you have been saying, you are multi-sectoral, you might have conducted some studies because you prioritize on children and families of different, natural disaster or conflict-related areas. So what were the challenges that you have identified? And then as to the solution aspect, how could they be? How does UNICEF prioritize its efforts in response to these challenges? Let's talk about that.
I think when it comes to children, everything is a priority. So it becomes very difficult to prioritize. But if I can mention maybe two of the issues which are probably key and which makes the burden of children and the women in particular. And I like to speak on children with women in particular because the first caretaker of a child is usually a woman. So if you're not taking into account women's perspective as well, it will be very difficult for us to fulfill the rights of children there as well. Security and stability is probably one of the key drivers. So one of the challenges which we have is everything that leads to conflict, whether it's ethnic conflict, whether it's regional conflict, anything that is in favor of conflict has a direct impact on the rights of children and women. So for UNICEF, it's extremely important that in our line of work, that we also contribute to stability, of reducing tensions within communities. Anything that can contribute to raise a conflict will have a direct impact and an immediate impact, and sometimes long-term and at a large scale. And this is why this is why UNICEF is a very strong proponent of peace and stability in particular. And that's a big challenge. So we are really encouraging everyone to walk the path of stability and peace, because without that, it will be very difficult, for children to thrive in a society. Natural disasters is something which is there, so I think we also need to take this into account. And some of those natural disasters, as we already know as well, are also human-induced when it comes to climate change. The droughts, the consecutive droughts which we have seen in Ethiopia, we cannot say that it's just nature. I think humankind has contributed. It might not necessarily be just from humans or citizens of Ethiopia, but globally as well, because the climate change is a global phenomenon. And it's not just because of the wrongdoings of humans in Ethiopia, but globally in situations. And I think it is something which we need to recognize more and more, because the effects of climate change will be much more devastating in the future to come if we're not recognizing these kind of things. And so these are the challenges which we have, and I think we are embedding them in our program. As I mentioned before, our traditional programs will still remain, providing health services, making sure that children can go to school in a safe environment, protecting children against harmful practices or against any kind of form of violence, providing nutrition so that children can grow and get all the nutrients and not suffer from nutritious or nutrition deficiencies consequences in that sense. So these challenges, as you rightly have mentioned, are there, and we make sure that in our program we think about those ones as well. How do we, for example, or how could we, because it's not yet 100% achieved, not only by UNICEF, but how can UNICEF contribute, for example, in reducing violence? We strongly believe that if you reduce tensions within the communities, you will reduce the risk of conflict. Because when you have disgruntled communities, there will find somebody to accuse. They will find or they will turn to people who have a different agenda in a certain way. So this is why, for example, education is extremely important. If you don't put young people, in particular adolescents, in educational institutions, whether it's a primary school, secondary school, whether it's a vocational school, where you can harness their energy, where you can give them purpose of life. You create young people which are desperate, which are unhappy, and you have sufficient spoilers within the communities who can recruit those elements for a different agenda. So this is why education is extremely important. The institutions as a school is not just to provide a learning environment, but it's also to bring in harmony, where cultures can be basically grasped in a certain way. So I think we should not be looking at education just as something where you can learn, but it is also a stabilizer within the society as well. This is where water and sanitation, for example, is another element. And we look at water and sanitation as just providing water. Water is life. But if you dig deeper in the analysis, who is fetching the water most of the time in villages? It is girls. And sometimes they have to walk for very long distance to get water. And when they walk for very long distance, you have security issues, and it takes a lot of time for them. Now, when UNICEF provides water into a community, it gives a lot of time back to young girls and women. So one of the reasons why women are also not going to school, it's not just because in some society we think we should be giving preference to boys. It's because women have a lot of other activities which takes time. And if we can reduce those activities, then it will allow them to do much more and be much more cost effective. And also will help women to be more self-independent in different ways than doing chores, which are very time-consuming in itself. So this is where water and sanitation is not just a health issue, it's not just a life issue, but it's also a women empowerment tool, where we're giving back quite some time to the female population, so that they can also benefit, from other services as well. The same thing with health facilities. If the health facility is closer to a community, it gives back more time to those women instead of walking to the community. And we know all those consequences of having not health facilities close into a community. We are asking for a pregnant woman to walk for 5 kilometers just to do antenatal care. But some of us cannot even walk 5 kilometers, even though when we are quite healthy in a certain way. So these are the kind of things which we're trying to solve together with government, where we're putting in strategies in place, but also funding the implementations of these strategies. So the challenges are there, and the challenges are not, in Ethiopia are not different from any of the African countries. But it's really how to see how we move forward of making the life easier, better, so that people, in particular young people and children, can enjoy their childhood and become someone productive within the society as well.
Thank you very much, Dr. Abubakar Campbell. I'm very much happy. I just have learned lots of lessons from you. It was very much impressive. Well, viewers, this brings us to our conclusion of the time that we have with His Excellency Dr. Abubakar Campbell, UNICEF representative to Ethiopia. I hope that you have got a very important lessons from our discussion. It has really helped you to have a highlight of what UNICEF is doing in our country, Ethiopia.